Great. Well, thanks for joining us this evening. My name is Riaz Gillani. This is Joe Klembczyk, and we're here to speak with you tonight about partnerships between health professionals in training and public school systems. So, just to give you an outline of what we're going to be speaking about tonight, we're going to give you a little bit about the background between the link between healthcare and education, why these partnerships between healthcare professionals in training and public school systems should exist, how these partnerships are being formed, and finally, what we can strive to contribute. So just to give you a little bit of context, The Economist recently put out a report that showed that the U.S. education system is far from leading. It's actually, in fact, in the middle of the pack. So obviously this has socioeconomic implications. This has implications for progress, for upward mobility. But more importantly, from our perspective, it has implications for health. If you look at the Millennium Development Goals, 4 out of the 8 Millennium Development Goals focus on either health or education. This clearly demonstrates that there's a strong link between the two. In 2010, Margaret Chan, the Director General of the World Health Organization, said, "Education and health go hand in hand. Education is a powerful way to break the cycle of poverty, ill health, and misery." So, it's a lot of national and international context, but what we're here to tell you today is that this matters here in Baltimore, and this matters to us. And so we, as health professionals in training, should play an important role in the education of the community we serve.
So what I'd like to talk about next is why and how we need to build these partnerships between health professionals and public school systems. So I'm going to start with reason number 1. The need is great. So to walk you through the slide here, on the y-axis we have percent of students at proficient or better on this year's Maryland State Assessment, and on the x-axis we have events and grade level. Now what you can see here is that the Baltimore City curve hangs below the Maryland State curve. So there's a deficit here that we want to work on, and we have to acknowledge that this is a function of the school system as well as many external factors, including socioeconomic status, housing environment, and health itself, bringing us back to the cycle between the two of them. So again, need is great. Reason number 2, we as students here can offer a variety of perspectives and backgrounds to this problem. So as public health, nursing, and medical students, we know this stuff. We straddle the world between health and education. We can make valuable insights and solve problems in this field. So again, the variety of perspectives is always going to lead to better outcomes in attacking this problem. And finally, number 3, there is an opportunity here to promote mutual understanding between the two communities of health professions and public school systems. So the way that we can do this is that when we go out into the community to work, to volunteer, to teach, it's crucial that we represent health professionals as caring individuals, as genuinely invested in the education and the future and well-being of these communities. And secondly, on our side, we need to make sure that we understand the problems and the characteristics of the communities we serve. And it's sometimes difficult to do that solely from the context of a hospital. So again, there's an opportunity to promote a valuable mutual understanding here. So now that we've talked a little bit about why, I'd like to go into how to build these partnerships. So I'd like to introduce you to Healthy Minds. Riaz and I have been working with this problem for 6 months now, and we teach math skills in an after-school format at a local elementary school at Commodore John Rogers School. We are incredibly encouraged by the initial positive outcomes, and we work with the faculty and staff there that are absolutely dedicated to providing the opportunity for their students to attain an excellent education. It's an absolute privilege to work in this environment.
So here are volunteers coming from different backgrounds, from the School of Medicine, from the School of Public Health, from the undergraduate campus, all coming together with the common goal of helping and building upon what the teachers are already doing with these students, but just providing that extra reinforcement. And again, it's really going to take that interdisciplinary approach to make a difference. We acknowledge that teachers, family, and friends have an immeasurable impact on these students, but we too can play a role in their lives. But we're not the only ones doing this. There's several organizations, student groups that are focused on forming these types of partnerships, some of which are HPrep, BASE, Merit, and Wall Street Academy Tutoring, all making these partnerships and making these connections in their own way. So finally, what can we as health professionals in training, or maybe even health professionals, strive to contribute? So it really boils down to three things. One, in the short term, we can help students to learn. So for us with Healthy Minds, that's through math. Two, in the medium term, we can create an incubator for good ideas. Good ideas are needed to work on this problem of education. Three, in the long term, we can strive to create a paradigm for better education where an entire community truly comes together to make an impact in the lives of these students. Thank you.